So the format for this activity, it's not actually a lab, it's small groups, and each facilitator will have 8 to 9 students in their group that they'll work through this with. And basically the students are assigned cases along with their facilitator list, and they are going to make a very brief video, 2 minutes or less, showing how to close a patient encounter, how to give the assessment and plan, something that they don't get to practice much. And along with closing a simple encounter, some of the cases will be giving difficult news or facilitating patient change. So when the way the day will work is prior to the start of that session, the students will have loaded up a video of themselves closing a patient encounter, and you will randomly go to that list of videos, which will be on a blog, and pick ones to play. And after you've played them, the group participants will give feedback, hopefully good feedback as we discussed, to the person who made the video. And then as time allows, you can play another video from another student. And I did, I will say in the lecture as well as on Blackboard that, to receive credit for participation in this activity, they have to upload a video and they have to participate in a small group. So they can't just do one thing or the other. So giving the assessment and plan on Blackboard, there's the small group schedule. Here are the cases. Here's the rubric that should be followed. Simple instructions about how to upload the blog after it's created. This is sort of like a picture by picture look at how to upload a blog if people haven't done it.
Good question, Dr. Darter.
Yes, sir.
Is the goal for us to watch at least one video from each of the 3 types?
I think that would be really good. So cases 1 to 3 are giving the assessment and plan. Cases 7 to 9 are facilitating patient change, and cases 4 to 6 are delivering difficult news. I'll put this in order, that might make more sense. And then lastly, we want, so I'm not going to read each of these bullets, but we would like to see that they included quite a bit of these items under each of those videos. One student makes one video. They're not going to make all these videos, of course. What we would like to see for all the cases is that they've used a tool called the ART loop, which is ask, respond, and teach. And that was heavily emphasized and will be heavily emphasized in the lecture prior to the activity. So the layout is that they'll have these instructions. The actual blogs, when you go to facilitate your group, you'll have, you'll see over here that each of you have a blog. And so once that, if I selected Dr. Nash, even though it says my name here, just ignore that, I can't figure out how to change that name. You'll have a list of students and their entries there. And then you'll just be able to click on that and then play the attached video.
You have to hit down on arrow, right? Is that correct? You have to hit that arrow right there? Yeah, it pops down all the numbers, right?
Yeah, I'm not, let's see, show empty blog. That shows all the students.
But that's what it looked like when you click that down arrow.
Right,
of everybody
I
who
see what
submitted.
you mean, yeah. So you'll find your student, I mean, you'll just be looking at 9 students at a time, but of course, over the course of several sessions, you'll have to find them, but they'll be alphabetic at least, and they'll just be the ones that were in your sessions. So that's, so the idea is that they do get a little bit of practice of something that they don't really get to practice a lot of. You know, they get to practice a little bit with standardized patients, but it tends to be something that is left out from a lot of encounters out in the real world. So I use the example as that we probably all have heard of someone or have experienced, you know, seeing a doctor and getting examined, and then all of a sudden it's done, and we were like, is that it? What, you know, and you know, somebody says, well, what did the doctor say? And you know, the patient says, I don't know, you know, I don't know the plan. So this is trying to help with that.
I was
Okay.
wondering if the students who don't get reviewed during the session, are they getting graded or assessed somehow, or some sort of evaluation on their blog?
And most of this activity is
Okay.
about seeing it, experiencing it, and then seeing kind of a feedback given, like a case presentations per se on our sessions. You don't always have to get, you know, your session, you know, feedback on your session to learn from the activity. Does that make sense?
Sure, yeah, that's fine. Thank you.
This is the schedule. And that'll be, we were waiting for that to get firmed up, but it'll actually be linked to that line in Blackboard. So you can see if we looked at Dr. Nash's first session, she has 8 students. And just as an example, Allison Barnes was assigned to case 7. Does that make sense?
Blog, will the students be able to view and comment on each other's videos?
They'll be able to view any blog, yeah, at any time. So they'll be able to view them if they want to. And so that's an option you can get into. And I tell you what, I'm gonna be honest with you. This is a project that I'm gonna brag on Dr. Darter for a minute, has taken over and has done a great job with it. And using the stuff we did in the CSW, I think, to really bring this activity further than we had envisioned. So that's awesome. And so as we do these activities, and what I've talked to Dr. Darter about is, as you do them, you kind of learn how to tweak them. And so we'll know a whole lot more come the end of August how we might want to do it again, or what was great, what went well. But I'm excited about how it's laid out now. I think it's going to be very helpful. And that feedback that was given, you know, the question Dr. Nash had about, okay, what about other students? And then, of course, Dr. Franco, you asked, can they potentially view other ones in their group and give comments? That's a good idea. There's some interesting, you know, things there with that. So enough fodder to chew on or think about, right?
Yeah. Great ideas.